Hey guys, this is Dr. Selene Parekh, the Fantasy Doctor. I'm going to be with you all season long to break down injuries of athletes every Sunday, every week as they occur. If there's an injury that you're interested in, feel free to tweet me and I'll get back to you as soon as I can with information and insight into those injuries. I'm going to give you the real insight, help you understand what's going on. Is there going to be surgery? Are they going to be back on the playing field? And if so, when and in what capacity? So we're going to break this down. Week 1 was supposed to start yesterday with a Hall of Fame game. We all know it didn't happen. But, you know, for patient and athlete safety, it's probably the best thing. The last thing you want is a player that goes down because of the hard surface of the paint, and then you end up with an ACL tear or an Achilles tear, and we'll all wonder, why did the Hall of Fame game happen? So, you know, we have to delay that the start of the preseason by 1 week, but, you know, it's okay. But that doesn't mean injuries aren't happening. And there's a series of injuries that we've already started seeing this preseason. And I'm going to talk about 2 of them. The first is the Achilles tendon tear. Now, we've seen a number of athletes go down this preseason with Achilles tendon tears. And the Lions, Eric Ebron was the latest this weekend to go down with the Achilles tendon tear. So let's break this down and understand what exactly is going on. The Achilles tendon is the largest tendon of the human body. And if you look at the side of your foot, this is what the outer part of the foot looks like, this is what the inner part of the foot looks like, and this is what the back of your foot looks like. The Achilles tendon is this little substance here, goes all the way from the heel all the way up to your knee. And the tear of the Achilles tendon typically happens right about here, about 3 finger breadths above where it inserts into the heel bone. Now that's a big problem and is a big injury. There are multiple ways to fix this, but in the NFL player, we definitely take them to the operating room. They have it surgically repaired where the ends are placed back together, and there's an aggressive rehabilitation that begins. But even still, you're looking at 9 to 11 months on average for these guys to get back onto the playing field and to be able to make their way to recovery and in a form that's meaningful in the NFL. So he's done for this season. Next up on the docket is the ACL tears. We are seeing a number of ACL tears this preseason. Now, if you think about your shin bone and your knee and your femur bone, they kind of sit like this. The ACL goes from the back of the knee to the front and helps to prevent that shin bone from sliding up on the femur bone. We've had 2 big ACL tears this weekend. The first was in the Bills' Ragland, who has a partial ACL tear, and I'm going to get back to that in a minute. The other was in Lions' Gronis, and Gronis is going to be out for the season. He's going to have that reconstructed. There's a lot of different ways to get to do that, and I'm not going to get into that in this video. But needless to say, he's going to have the ACL repaired and reconstructed. Look for him to be out about 9 months. Occasionally, we'll see players back on the field at about the 6-month time point, but that's highly aggressive. The more usual timeline is anywhere from 9, 10, 11 months. So we'll see how he does. So let's get back to the Bills' Ragland, because that's a more important question that's been going on. He has a partial ACL tear. Now, when it's a full ACL tear, that's easy. The knee is unstable, and these guys end up in the operating room. But when you have a partial ACL tear, it all depends on what the physical exam is like. And he's slated to get a second opinion this week. Now, in his exam, if his knee is absolutely stable, and it looks like by the MRI, this is a questionable partial ACL tear, look for him to maybe have PRP injections or stem cells injected into the knee, all to help the healing go along. He should be out about 2 to 4 weeks in that scenario, and then you'll see him back on the playing field. If, however, on the exam he is unstable, then his season will be lost. He will end up in the operating room, and he will end up with a reconstruction to occur. The real gray zone is, well, you know, I'm not really sure if the knee exam is stable, and you're not really sure what the MRI shows. In that scenario, look for him to go to the operating room where the surgeons will do a knee arthroscopy. During that knee arthroscopy, they're going to look at how much of the ACL is damaged, and they'll examine the ACL while looking at it with the arthroscope. Again, if it looks like they can get away without surgery, without a reconstruction, and using PRP or stem cells, that may occur. If, however, they feel in the operating room at the time of that scope that they need to reconstruct it, well, then that may occur. So these are the scenarios that are going to roll out this week. We'll see how the week goes on. and I'll continue to keep you up to date. Feel free to follow me on my YouTube channel at the Fantasy Doctor. You'll find a lot more in-depth stuff on a weekly basis and on a daily basis as news breaks. This is Dr. Selene Parekh, your Fantasy Doctor.